When the entire homeopathic world loves to call it as ACTEA racemosa, I like to call by its pet name Simsifuga. The common name is black cohosh and it belongs to Ranunculaceae family. In the eye of magic folk medicine, this drug black cohosh is highly considered as a metaphor for moon as well as feminine characters because both menstrual cycle and the lunar cyclic changes shares a period of 28 days. The sphere of action is over the entire nervous system including brain and spinal cord, female genital organs and the bellies of muscle. The pathogenesis, it primarily acts on nervous center producing an irritant and inflammation condition, indirectly extends to rheumatic, muscular, neuralgic and female genital disturbances. Moving on to the keynotes is rheumatic dysmenorrhea, rheumatic pain and mental generals. Moving on to the first one, which is rheumatic dysmenorrhea. For easy understanding and better remembrance, remember dysmenorrhea means pain during menses. So remember two conditions, which is pain, menses, along with that pregnancy. Moving on to the menses, we can say irregular and exhausting menses. Whenever we feel exhausted, we will turn on AC. So remember that there are other two remedies, which is alumina and cocculus. And the third condition is delayed or suppressed menses. It becomes delayed because of three important ailments, which is due to mental emotion or cold or fever or any chorea or mania of mental conditions. Remember, the mental conditions will get aggravated during menses in Simsifuga. That is, more the flow, more the suffering is. Moving on to the pain, not only menstrual pain but also other pain conditions of drug Simsifuga has been grouped together here. Moving on to the first one, which is menstrual pain. Pain darting from side to side, especially on two regions, which is ovarian as well as uterine region. The second one is inframammary region pain can be seen, especially on the left side. The other remedy is Ustilago. Third one is ciliary neuralgia, that is pain starts from the orbit, that is globes of the eye, and passes through temples, vertex and reaches occiput. Aggravation going upstairs, better lying down. Then moving on to pregnancy. Here remember three important features, that is during pregnancy, during labor and reflex action. So during pregnancy you can find nausea, sleeplessness, false labor pain and abortion, especially on the third month. And then during labor you can see on the first stage of labor there will be highly shivering and convulsions can be seen. And moving on to the reflex action, especially reflex action can be seen on the brain and heart. So because of rigidity of the os, you can see pain which will be severe, spasmodic and tedious. Remember, when given at the last month, Simsifuga shortens the labor. Then moving on to rheumatic pain, for better understanding, group them accordingly with LSMC pattern. The location is bellies of muscle and spine. Sensation, altogether you can find stiff, lame and contracted feeling. The modalities you can see, aggravation you can see using arms for sewing, typewriting and piano playing, and as well as after dancing, after skating, after rigid muscular exercises. Moving on to the final one, which is mental generals. There are three important characteristic mental generals you have to note. The first one is puerperal mania, that is the patient feels that she is going crazy and she tries to injure herself. The second one is she has a strange illusion that mouse running under chair. The other remedies which includes are lac canine and ethusa, which have the same feeling. The third one, which is highly important, the Simsifuga patients feels that there is a heavy black cloud settled over her and enveloped her head. The entire drug Simsifuga is here.